We'd like to end, first thank you for coming. I hope you've learned a ton of information. There are so many interesting things happening in sleep. You saw on the Today Show last week, they talked about pediatric sleep. What's really interesting is the comment is, how do we treat sleep? With a CPAP. Well, only 1 to 2% qualify for a CPAP. And as we know, 9 out of 10 kids have at least one or more symptoms, which would mean that 88% of these children are walking around with nothing being done for them. And we're hoping that we will be those ones that will be on the Today Show to explain the full message. There's been a lot of conversation on the follow-up. So if you follow, I think it was Good Morning America had the piece. Go look on there, and they do talk about Healthy Start on those comments. And a couple parents have nothing to do with us commented, please, if you could add this to your program, this would be what parents would be looking for. ADA in October at their annual meeting is voting on this new policy. The policy includes pediatric sleep. And what it is telling us to do as dentists is to look and to evaluate airway and improper growth and development, which is exactly what all of us are doing here this weekend and hopefully as we move forward into our practice. So I don't know if you're attending the ADA. If you are, please join, go to the delegate meeting, vote on it. If you're not, what will happen is they'll vote. I'm pretty sure it'll pass, and then it will go to the states, and each state will be implementing this into their protocol for dental practices. It will say that every dentist should be evaluating airway and improper growth and development in their pediatric patients. So as we know, a dentist can't diagnose sleep apnea. However, we can address and identify the underlying root causes. So again, that's what our mission is at this point in time. I think yesterday we talked a little bit about if we suspect there's some issues, we can do a home sleep study test. What is interesting information that we found out, even though the insurance world doesn't cover usually those home sleep study tests, what they do cover is the information that's gathered. And you can have a sleep MD evaluate that home sleep study test, use that information if you go ahead and claim for sleep apnea. So because that sleep medicine doctor will have prescribed an oral appliance and then you can proceed with treatment. So there are advances that are happening in the world of sleep and in the world of pediatrics.